Hi, I'm Ira. I'm here with Dr. Terence Lim from Urologi in Mount Elizabeth Orchard. Dr. Lim is an experienced surgeon with more than 20 years experience in both public and private sector. So Dr. Lim, what is the cause of kidney stone?
Generally, the most important cause of forming stone is not enough water intake or dehydration. And of course, diet has been shown to play important factors in the formation of kidney stones. For example, a diet high in oxalates or inadequate calcium intake are generally the main culprits.
Okay, what is oxalate, Dr. Lim?
Actually, no. Oxalate is just okay. Oxalates are some minerals that are found that are commonly found in things like chocolates, dark greenish vegetables, and then black tea. Yes. Okay. So my general advice to patients who are prone to stone formation is they can eat, but those food that is high in oxalates, they may want to try and cut down on them, but more importantly, drink more water after that.
So who are more prone to having kidney stone?
Generally, the patients with a strong family history of stones. If you are overweight or obese, when your BMI is more than 30 to 35. When you are constantly dehydrated, or when if your job involves a lot of sweating, then these are people at high risk of forming stones.
I see. So for those people, you need to cut down on the food that contains more oxalate.
Yes, but more importantly, drink more water.
I see. Okay, so what are the symptoms that the patient can feel when they have kidney stone?
Okay, so generally the symptoms will depend on the location of stones. If the stones are found in the kidney, and especially if they are small, oftentimes there's no symptoms. So these stones are generally being picked up when we do certain imaging like an X-ray or ultrasound or even CT scan. Okay, but once the stone causes obstruction, regardless of whether it's in the kidney or in the urine tube, what we call a ureter, then patients can have symptoms. The symptoms may include blood in the urine. If the stones are in the kidney, they will generally feel pain at the back of the kidney. If the stone has dropped into the upper part of the urine tube, what we call the upper ureter, they may have pain that radiates from the back to the front part of the abdomen. And if the stone drops further down to the ureter that's closer to the bladder, sometimes the pain may even radiate down to the groin or the lower part of the abdomen.
I see. So the pain that the patient feels, is it like sharp shooting pain, or is it a gradual pain that will get worse and worse and worse?
Okay, it's usually described as a colicky pain, which means that it comes in wave. In waves.
Oh, okay.
Yes. Yeah, it's a little bit like when you have food poisoning, the abdominal colic, like that.
Oh,
Yes.
okay. So how do we differentiate then?
Okay, so usually for abdominal colic, you have other symptoms, for example, nausea, vomiting, diarrhea, and usually for abdominal colic, the pain is usually central. Okay, but for stone pain, the pain is from the back, usually on the side where the stone is. Okay, and then it may radiate down to the groin or to the lower part of the abdomen. Then in some patients where the stone is very, very near the bladder, they may develop urinary symptoms like keep wanting to go to the toilet, sensation that they cannot finish their urination, or needing to go to the toilet very, very often.
It sounds a lot similar to UTI, isn't it?
Yes.
Oh, okay. So they will have symptoms like UTI.
Yes, that's because if the stone is near the bladder, it will actually cause some irritation, inflammation in the bladder. So the bladder reacts like it is having an infection. So the symptoms are similar.
Okay. So how do you diagnose this kidney stone? You mentioned you need to do ultrasound.
Yes, so generally the diagnosis will be taking a history from the patient. So when they have the typical pain, okay, then we may proceed with doing some form of imaging. The simplest kind that is available in the clinic is the ultrasound. So big stones in the kidney or sometimes smaller stones can be picked up on the ultrasound. Okay, if the stone drops into the ureter, the ultrasound may not be able to see the ureter, but if the stone is causing obstruction, we can see swelling of the kidney. Then we may know that there may be stones in the ureter. Of course, the gold standard for diagnosing stone is a CT scan.
Okay.
Yes.
So when patient come, usually we'll do ultrasound first or straight away CT scan.
Generally, if the symptoms are very, very typical of stone, we will go straight for the CT scan. But if we are not sure, in some patients with big symptoms, we may just do ultrasound first at the bedside, and then if you see some swelling or stones, then we may proceed with the CT scan. So sometimes when, especially in patients where they may not want to do a scan, CT scan, then we may do an ultrasound together with a normal abdominal X-ray.
Okay.
Yes.
So does this, will it shows in blood test as well?
Stones are generally not shown in blood tests. Yeah, but there are some blood tests which we do to see if the patients are at high risk of forming stones. So for example, we do their uric acid in their blood, their calcium levels in their blood, and their phosphate levels in their blood.
Okay. When you found a patient with the kidney stones, what are the treatment options? What would you advise them?
Okay, so I usually tell my patient treating stone is like buying a house. Okay, it depends on the location and the size of the stone. So there are various options for treating stones. For example, if the stone is in the kidney and it is less than 1 centimeter, we can do what we call ESWL, or the extracorporeal shockwave lithotripsy. This procedure involves a shockwave that is delivered from outside the skin, okay, into the kidney to fragment the stone. Then we usually get the patients to drink lots of water, and which will subsequently result in an increased production of urine to flush out the stone. This is one of the safest and the simplest way of treating stones.
So there's no cut needed at all?
There's no cut needed at all. But depending on the location of stone, sometimes the stone-free rate may be relatively low for this procedure as compared to the other more invasive approach. So if we have very, very big stones in the kidney, especially it involves almost the whole kidney, generally we do what we call a PCNL, or a percutaneous nephrolithotomy. This will involve drilling a hole, a 1 centimeter hole from the skin into the kidney, and then we will then see the stone and use ultrasound to break and suck out the stone fragments.
So the cut will be on the side?
At the back, yes.
Oh, okay.
Yes. And for stones that is not so big, maybe around 1 centimeter to 2 centimeter, and if we want to achieve a high stone-free rate, we can do a scope where a flexible scope is introduced all the way to the kidney, and we use laser to fragment the stone. After that, we'll pick up the fragments one by one.
Using scope?
Yes, using a scope.
Then you will break the stones?
Yes, using laser.
Okay.
Yes.
Yeah, but can a patient choose? Okay,
Yes.
I want to do this, I want to do this.
Well, the patient will have a choice. Okay, of course, if let's say the stone is too big, then generally we advise patient not to go for ultrasound, the shockwave, because the outcome would be very, very bad. Yes.
What is the risk of surgery for the stones?
Okay, so the most dangerous risk is, of course, the risk of general anesthesia, because all patients who are undergoing either a scope or the PCNL will require them to be under general anesthesia. Shockwave can be done either with painkillers or with some light sedation. Okay, so patients who are high risk of general anesthesia can have significant complications like stroke or heart attack. Okay. With regards to the scope, generally it's done as a day surgery. The main complication may be a bit of bleeding in the urines, risk of urinary tract infection, but the risk is generally low. Okay, there is probably a less than 0.01% chance of injuring the urine tube as we go up. That will require open repair, but that it rarely occurs. Okay, for PCNL, I think one of the major risks is bleeding because we are drilling a hole into the kidney, and that tract can bleed. So PCNL, generally patient stays in the hospital for 1 or 2 days before they go home. Yes, but other than that, small risk of urinary tract infection. But having said that, the incision is only 1 centimeter, so actually recovery is actually quite fast.
Okay, so if we have a stone in the kidney, it's not always that we need to remove it. Only when it causes problem, then we need to remove
well,
it.
It will. That it depends. If the stone is less than 5 mm, and especially if there's only 1 or 2, we will recommend just leaving it alone. This is because stone less than 5 mm, if it ever drops out of the kidney into the urine tube, there is a 60 to 70% chance that it will come out by itself. That's why we may opt for conservative management. Okay, but if stone that is larger than 5 mm, especially those bigger ones, or there are multiples, then some patients may want to avoid experiencing the pain when the stone drops out. They may want us to intervene earlier, and so we may choose to, in such circumstances, either doing a scope or ESWL to break it into smaller pieces. Treating the stones early may also help reduce the chance of the stone growing too big, that requires us to do more invasive procedure like PCNL.
So, if we leave the stone in the kidney, is there any chance that we will disrupt the kidney function?
Okay, so generally small stone in the kidney should not affect the kidney function, but if the stone is causing urinary obstruction and the kidney is seen to be swollen, then in the long term the kidney function will be affected.
I see. Okay. So can the kidney stone reoccur after you remove the stone? Can it reoccur again?
Yes, there are studies to show that if you have formed 1 stone, even if we completely clear of the stone, there's a 50% chance in the next 10 years you will form another stone. So kidney stones can recur.
Okay. So the people who have kidney stone will have will be more prone to have another kidney stone in the future.
Yes.
Even though it's removed.
Yes.
I see.
So we will generally advise a patient to maybe change their diet, drink more water, and hope for the best.
Okay.
Yes.
So is there any any food or lifestyle changes that we need to do to prevent the stones in the first place?
Okay, so behavioral changes and lifestyle changes will include drinking adequate amount of water. I usually tell my patient every time you pee, the urine should be relatively clear or light yellow. If you find that urine is very concentrated, it probably means that you're not drinking enough water. You may want to cut down on food that's high in oxalates, high in uric acid. Okay, then there are certain medications which we can give to help reduce the risk of stone formation, but that is generally not very popular because very few people want to take medication long term just to prevent stones.
So the medication is only to prevent?
Is to reduce the risk.
Reduce the risk of formation. How does it work?
So it depends on what. Before we start to give the medication, right, we will generally do more investigation like a 24-hour urine metabolite test to see whether or not there's any abnormalities in your urine. For example, in patients who have very, very low stone inhibitors like citrate, in their urine, then we may give medication to help to supplement the citrate in their urine, so to help reduce the risk. Or for example, if the patients have very, very high calcium in their their urine, then we can give a certain medicine. This medicine is also used in high blood pressure, treatment of high blood pressure. So it has been shown that this medication can help to reduce the amount of calcium that is being excreted by the kidney into the urine. So reducing the risk.
You only give this medication if there are other symptoms that might trigger the forming of the stones.
Yes, so we usually give all this after the 24-hour urine metabolite test to see what exactly it is in excess or in shortage, and then we will treat accordingly.
Okay. Yes. Thank you so much, Dr. Lim, for your information.
Okay.